Welcome to Healthy Lifestyle Tips, your go-to channel for all things health and wellness. Today, we are going to talk about a topic that may sound strange at first, but has become a promising therapy for a wide range of gastrointestinal disorders: fecal matter transplants. You might be wondering, what are fecal matter transplants? Also known as FMTs, they involve transferring fecal matter from a healthy donor into the gut of a recipient to restore healthy bacteria in the gut microbiome. This process has been found to be particularly effective in treating conditions such as Clostridioides difficile infections, inflammatory bowel disease, IBD, and irritable bowel syndrome, IBS. Let's delve a little deeper into the topic and understand how FMTs work. Our gut is home to trillions of microorganisms, including bacteria, viruses, fungi, and other microorganisms collectively known as the gut microbiome. These microorganisms play a crucial role in regulating our immune system, metabolism, and overall health. However, when the balance of the gut microbiome is disrupted, it can lead to a wide range of gastrointestinal disorders. One of the most common disruptions to the gut microbiome is through the use of antibiotics. While antibiotics are an essential tool in fighting bacterial infections, they can also have unintended consequences on the gut microbiome. Antibiotics work by killing bacteria, and while they are effective at targeting harmful bacteria, they can also wipe out beneficial bacteria in the gut. When the balance of the gut microbiome is disrupted in this way, it can leave the patient vulnerable to overgrowth of harmful bacteria such as Clostridioides difficile. Clostridioides difficile is a type of bacteria that is normally present in the gut in small numbers, but when the balance of the gut microbiome is disrupted, it can multiply rapidly and cause infections. Clostridioides difficile infections can cause a range of symptoms, including diarrhea, abdominal pain, and fever. In severe cases, it can even lead to life-threatening complications such as sepsis. These infections are especially prevalent in healthcare settings, such as hospitals and nursing homes, where patients are often exposed to high doses of antibiotics. FMTs work by reintroducing healthy bacteria into the gut to restore the balance of the microbiome. The fecal matter is usually obtained from a healthy donor who has undergone rigorous screening and testing to ensure that they are free of any infections or diseases that could be transmitted to the recipient. The fecal matter is then processed and prepared for transplantation, which can be done in several ways. The most common method involves administering the fecal matter through a colonoscopy or an enema. Alternatively, capsules containing fecal matter can be ingested orally. Although FMTs have been found to be highly effective in treating Clostridioides difficile infections, research has also shown promising results in treating other gastrointestinal disorders such as IBD and IBS. In a recent study, researchers found that FMTs were effective in inducing remission in patients with ulcerative colitis, a type of IBD. Moreover, FMTs have the potential to treat other conditions beyond the gut. Recent research has suggested that FMTs may also have the potential to treat other health conditions that are not directly related to the gut. One of the areas where FMTs have shown promise is in the treatment of metabolic disorders such as obesity, type 2 diabetes, and non-alcoholic fatty liver disease, NAFLD. These conditions are characterized by abnormal metabolism and have been linked to changes in the gut microbiome. For example, obesity has been associated with changes in the gut microbiome that affect the way the body processes nutrients and stores fat. Studies have shown that fecal transplants from lean individuals can alter the gut microbiome of obese individuals, leading to improvements in insulin sensitivity and weight loss. Similarly, type 2 diabetes has been linked to changes in the gut microbiome that contribute to insulin resistance and high blood sugar levels. Some studies have found that fecal transplants from healthy donors can improve insulin sensitivity and glucose metabolism in people with type 2 diabetes. Non-alcoholic fatty liver disease, NAFLD, is another condition that has been linked to changes in the gut microbiome. NAFLD occurs when excess fat builds up in the liver and is not caused by alcohol consumption. Some studies have found that fecal transplants can improve liver function and reduce liver fat in people with non-alcoholic fatty liver disease. Although the research on the use of FMTs for metabolic disorders is still in its early stages, these findings are encouraging and suggest that FMTs may have a broader role to play in improving overall health and wellness beyond just treating gut-related conditions. However, FMTs are not without their risks. There have been reported cases of adverse reactions such as infections and allergic reactions, although these are rare. Therefore, it is crucial to undergo thorough screening and testing before undergoing an FMT. In conclusion, FMTs are a promising therapy for a range of gastrointestinal disorders, particularly Clostridium difficile infections. They work by restoring the balance of the gut microbiome by reintroducing healthy bacteria into the gut. Although they are not without their risks, they have the potential to treat other conditions beyond the gut, making them an exciting area of research. If you found this video informative, please give it a thumbs up and subscribe to Healthy Lifestyle Tips for more health and wellness content. Thank you for watching.